Hey everybody, and welcome back to another edition of the Open Forum podcast. Today we have with us Dr. Gary Sidley. Gary Sidley is a former consultant clinical psychologist with the NHS, having retired in 2013, and since then stayed pretty active in multiple different ways with multiple different organizations, and more recently, and sort of what brings us here today, has been involved in the Heart Group, and if I'm not mistaken, your organization Smile Free as well. We're just going to dive on into that. He's got over 3 decades of experience working as a clinical psychologist, more than I've got on the planet. So Gary, please take it away. Why don't you take 2 minutes, introduce yourself, and then we'll dive on in.
Okay, thank you. My name's Gary Sidley. In brief, what my background is I left school at 18 back in 1977, I think it was. Did a science degree, biochemistry, physiology first. So I was a proper scientist in those days. And just before I graduated from Leeds University in 1980, I kind of thought, I don't really want to work in a lab. Mental health seems much more interesting. So I kind of made a decision at that point to pursue a career in psychology. So when I left university in 1980, I entered the NHS as a nursing assistant, actually, on an acute admission ward to begin with. Then qualified later as a psychiatric nurse, worked through the early part of the 1980s. And then in 1987, which was always the plan, really, then changed kind of profession and went on to train as a clinical psychologist. Thereafter, working for 34 years in adult mental health services in the NHS, for the last kind of 14, 15 years of that as a consultant clinical psychologist. I was fortunate to be able to opt for early retirement in 2013. And at that time, I was actively campaigning for better mental health services. I think we could do a lot better than kind of biological psychiatry, illness like any other, too much focus on drugs, really. So I put my energies into various campaign groups, wrote a book in 2015 called Tales from the Madhouse, and kind of was kept busy, in various groups, working alongside ex-psychology colleagues and some new ones, trying to improve mental health services. I think we always regarded biological psychiatry as a bit of a tyranny in its own really, to trample on human rights around the Mental Health Act, etc., etc. Well, in 2020, of course, that relatively specific tyranny was replaced by a much larger one.
Oh yeah.
So since the beginning of 2020, I've been putting my energies into trying to resist what I see as a very concerning direction of travel for us. And helping me do that, I've been involved, as you alluded to, Sonny, 3 particular groups. One is the Heart, the Health Advisory group, smilefree.org, which is the anti-mask mandate group. I'm very passionate about masks and how they are the most insidious of all the restrictions. And more recently, Panda, which is a bit more kind of looking academically at some of the propaganda stuff. Okay. And my 3, just to finish that little bit off, my 3 main areas around the COVID stuff are psychological nudging, masks, and of course some of the mental health consequences of restrictions.
Yeah, I think that the mental health aspect as a result of the restrictions is something that will be interesting to touch on to, especially given your prior work into biologics and advocating for patient rights, essentially, and almost a vindication of your advocating for that in the last couple of months, there's been a few more scientific papers that have come out to support the fact that SSRIs are not less effective, but potentially have no effect, which, you've been campaigning for that for quite some time. I've been made familiar with that from Irving Kirsch's work as well in that area. And I think that's something that maybe we'll touch on towards the end, especially given what your doctorate thesis was in with, what was it? Predictors for suicide, I believe. So that could be quite an interesting topic to dive into with yourself. But why don't we start at the start and go back to, like you said, what the mask mandates were and what the measures that were used against the populace en masse as tools that were fear-inducing and specifically designed to be fear-inducing. I think a nice quote that I've got from Spy B is that the perceived level of threat needs to be increased among those who are complacent using hard-hitting emotional messaging. And that was in March the 22nd of 2020. Now, it only really kicked off in the sort of Western world in end of Feb, and they'd already decided within a month, hey guys, we need to hit them hard and pull on their heartstrings. But no one was the wiser in the general public as to what was happening to them and the way that their thoughts and views and the way they looked at their families and friends were being manipulated as well. Why don't we start there?
Yes, the kind of psychological, well, let's use the right words, manipulation, I think, from the outset was clearly strategic, as evidenced by those minutes that you've mentioned. And I think that's one of the first things that actually struck me, Sonny, back in January, February 2020. To be honest, I was very concerned. Even then, I'm not blowing my own trumpet there, but I was saying, this is not right. This isn't right. I think that's possibly because I did have a background in risk and risk assessment and risk aversion, as well as a full grasp of how egregious the big pharma companies can be. At the very least, they always tend to overstate the advantages and underreport the harms.
To put it mildly, yeah.
I think that's at least, yeah. And also in my NHS career, I did interface at times with infection control departments, and I don't want to kind of sully the whole infection control kind of profession, but one thing that I always kind of familiar with always struck me about them was that even though I think they often meant well, they could be rather kind of mono-focused in their approach and not see the bigger picture.
Almost like horses with blinders on.
Yeah, that's right. Yeah, so all those things I think maybe were advantageous, and I thought that this isn't right. There's something wrong here, and I started to do my own research and dig into the figures and look at some of the tactics that were being used. And this is when it became crystal clear to me about the nudge units, the behavioural scientists, who interestingly are embedded in pretty much every department of government. I think people would be surprised at how many behavioural scientists are around, not just in the public health sphere, and on advisory groups, but in the tax department.
It's insidious, isn't it?
It is.
The extent to which they've gone to since, I mean, it's said that it's from David Cameron's cabinet in 2010, but that is, not to sound kooky, but that's just what we know of what's available information. But if you look at a company like Cambridge Analytica, that was essentially what they were doing.
Yes.
That it had to stem from somewhere.
Yes. Behavioural science has been around for a long time, and some of the strategies, some of the so-called nudges, have been used by the state and by private companies, of course, to sell their wares for many decades. But I think the thing that changed in early 2020 was just the intensity and the comprehensive coverage, particularly driven by by the state. And these methods, there's a whole range of nudges, of behavioural science techniques of persuasion. And just if anybody is in doubt, the definition of a nudge is a kind of psychological strategy of persuasion that has its influence often below the level of someone's conscious awareness. So people don't know that they are being influenced when they are, and it kind of contrasts quite starkly with the traditional methods of government persuasion, like information provision and argument and rational debate, kind of thing. So
people accepting it as this is information being put over to me, not being manipulated behind the scenes and being brought to a final idea without knowing that someone has essentially led them along the alleyway without them realizing.
That's right. That's spot on. Yeah. And like I said, there's a wide range of these nudges, but I think there's three that have been particularly concerning around their ethical basis. The most obvious one is fear inflation. The idea, I suppose, exploiting the idea that when someone is fearful, that does have an impact on their kind of cognitive faculties. So that if someone's in a state of anxiety, they will tend to focus selectively on things that are threatening in their environment. They'll tend to have preferential access to scary memories from the past. They'll tend to interpret things in a more scary way. And that's been exploited by the behavioural scientists in a big way to get us to follow the restrictions. Alongside that, and equally as egregious in my view, are the so-called ego nudge and the so-called norm nudge. I'll just explain that. The ego nudge is the technical term for shaming, really, where we human beings tend to like to view themselves as being decent, virtuous, good human beings. And are reluctant to see ourselves as the opposite of that. So what the nudges did from an early stage was they associated following the restrictions with being a good individual, and not following the restrictions or the vaccine rollout for that matter as being bad. Normative pressure plays on the fact that we all kind of feel rather uncomfortable being in a minority. So we tend to want to go with the herd rather than kind of stand out as a minority.
Yeah, sticking your head above the parapet and taking the flak. I was called a murderer by my colleagues by a colleague of mine, and for not wanting to get jabbed. And I was told I was the reason that we kept going in and out of lockdowns and whatnot. And I can totally see how these ego nudges would convince someone to just start towing the party line.
Yeah, that's quite right. And nudging has been responsible for things like that, Sonny. The vilification of the unvaccinated. That's undoubtedly been a consequence of nudging. As with the whole other raft of collateral damage, of course, mental health, but also, the tens of thousands of non-COVID excess deaths that we've had throughout this period and still continuing to endure. Yeah. How many of them are likely to be the direct result of people being too fearful to present to hospital, or old people dying of loneliness because they're too scared to have their relatives around, and so these kind of methods do have some pretty serious ethical consequences, although the stakeholders do seem rather reluctant to engage in a constructive conversation about the ethics, which is rather
getting them to acknowledge it is already a task enough on its own, let alone engaging on it.
That's right. Yeah.
What's norm nudging then?
Norm is where you actually exploit that. So the most obvious way that they've done that throughout the COVID era was to say things like, You know, 97% of people are following the lockdowns. 95% of adults have got the vaccination.
Yeah.
You know, that's the simplest kind of version of it. But the masterstroke from the nudge's point of view, though, was our friend the masks, because that is a very kind of clear indication about who's following the rules and who isn't. You know, because the thing about normative pressure is that, yeah, you can keep on telling people that they're in a minority, and that works to some degree, but then it starts to wane in its intensity. You have to keep reminding them.
Yeah.
With masking, you know, you don't need to, because there's something built into the population that instantly differentiates between those that are following the rules and those that aren't, between the good guys and the bad guys. So, like I've always argued with masks, that, you know, given that flip-flop that happened in early summer 2020, when all the, you know, early to 2020, as you probably know, all the experts were saying, you know, across Europe and America, masks are no good. You can't mask the healthy. It's unhelpful. It'll cause more harm than good. And then between about April, May, and June 2020, it kind of completely flipped. And that wasn't in response to any kind of rigorous study or kind of strict.
Nothing at all. Yeah.
No, clearly that was a political decision, and I'm convinced that one of the key factors was that it helped the nudging process, because masks are a great compliance device, and that seems to me the most likely reason for that kind of that U-turn back in 2020.
I mean, not only did they go back to saying masks were the be-all and end-all, but in America, at least, they started talking about double and triple masking. As silly as that sounds, and looking back today, but people were genuinely double masking and triple masking. And I had patients coming into me in clinic with 2 masks on, and I thought to myself, you poor soul, you've been had, and this isn't the time nor place for me to tell you that you've been had, because I fear that that's just going to break down the therapeutic relationship that we've built up at this point. And you're going to be so set in your way that if someone tries to break that belief that you have, then it's going to be war, because this is so deep seated into people. It's not just a mild thing like, oh, I like the color blue, you like pink, whatever. This is really, it got down to almost as fundamental as religion for some people, whether you would mask, or, you know, people were being excommunicated from families, not being allowed to go for Christmas dinner because they weren't following some aspect of the rules. It's unbelievable the extent to which that the nudges worked. Of course, they're designed to. Of course, we've got behavioral scientists that have spent a long time looking into these things. But
very, very powerful, and I think it is shameful, the impact that it's had on people. I'm sure I'm not alone in having witnessed people who are in the street who are just petrified, you know, who jump out the way almost into the middle of the road, get away from you, kind of thing. You know, that is really sad, and the impact that's had on a lot of people. A lot of them elderly, not all, but a lot of them are elderly, who are struggling to breathe anyway, and then kind of staggering around the streets with masks, even maybe double masks on. You know, it really is shameful, and you know, I think there should be some comeback for that.
Can you give any examples of other nudges that were given to people which they might not be aware of? Because one of the things that we have to do looking forwards is attempt to try to educate ourselves so that we are cognizant of it if and when the next time rolls around we have a situation like this.
Yeah, sure. If you take the affect nudge, the fear nudge, then the most obvious kind of way that was exploited was through some of the slogans that we used. You know, stay home, protect the NHS, save lives. If you go out, people will die. No one is safe until we're all safe. that was a classic one. In fact, those examples are actually fear-inducing and exploit the ego nudge as well, because it's kind of saying that if you're a virtuous person,
you're going to stay home.
You stay at home. But some of the fear ones were like the stats that were, the daily death count that was given, non-contextualized, not recognizing, for example, that 1,600 people die every day under normal circumstances. And when deaths reduced, then it was cases, wasn't it? These kind of meaningless kind of cases, a large number of which would have probably been asymptomatic. We had that recurrent footage, didn't we, from Lombardy in Italy, in northern Italy, I think, at the beginning of the COVID era, and sort of images of acutely unwell people in intensive care units.
People dying in their apartments because they couldn't get out. And then you had the footage of people in China dropping dead on the streets and convulsing and all the rest of it, which
coffins piling up in New York. That was another one we were showing. That kind of thing. So they were all towards fear. I've mentioned some of the things about the ego nudge already, really, but another one for the ego, which again, remember, is associating following the restrictions with being a virtuous person. There's that actor on telly that, saying things like, I wear my mask to protect my mates. I make space to protect you. This kind of thing. And it's a normative pressure one we've already discussed, haven't we? Which is often quoting dodgy statistics. 92% of adults are already vaccinated. That's what the BBC was claiming in the link of the documentary, and seems more likely, probably around 20%ish are not vaccinated would be a more accurate figure.
It was to boost the numbers, right?
Because the mask beautifully kind of reinforced those three nudges. It increased fear for obvious reasons. If you're wearing a mask, it suggests one of us is a biohazard. And we need to be really cautious, as well as, interestingly, keeping fear going. I don't know whether you're familiar with the concept of safety behaviour, but a bit like wearing a garlic clove around your neck to keep Dracula at bay. People believe it works because Dracula doesn't get you. Same with this. If you go out wearing a mask, even if nothing bad happens, day after day after day, there'll be part of you at the end of it that thinks at some level in your head, it was a near miss that I got away with it this time because of my mask. Keeps the fear going. Whereas if you drop the mask, you're then open to new learning.
So in a situation where someone hasn't been massively manipulated in that way to believe that the mask is a thing saving their lives, what they would find, again, in a normal situation is 5-6 days wearing a mask going out. Oh, actually, nothing happened. I don't need the mask. But in this instance, it's 5-6 days they've gone out with the mask, they come home safe. The only reason I got back home today, the only reason I survived this apocalyptic I am legend scenario here was because of the mask. And that's my be all and end all. It's my savior.
Yes.
In that kind of way.
That's why we keep saying the masks are so insidious, really. I think they are really, really unhelpful in all kinds of ways and at several different levels. I think also it kind of alludes to as well about, people often say, how can we get more people to speak up about what's gone on and what's continuing to go on? And that's really difficult, isn't it? Because, as you implied earlier, a lot of people are very, very scared. A lot of people see it more as a religion now, religious intensity. So I've always been of the view, really, just using kind of psychological principles, that the people, if you look at this like a spectrum continuum, where you've got people who are more skeptical at one, maybe 10-20% now, maybe at one end of the spectrum, and then you've got the really kind of strongly strident, dominant narrative people at the other. I think the key group is the silent middle, the ones in the centre, because I think the strident pro-narrative people aren't really going to change anytime soon. They're too invested in it now. They've kind of they've kind of broadcast their views so widely and often quite stridently that it's going to take a brave man or woman, I think, to kind of start to
approach the conversation and unwrap it all with them. Yeah.
That middle group, I think, there's people who are with a whole range of ambivalence, I think, various degrees of ambivalence about at least some aspects of it. And I think it's that group that we're, fingers crossed, we hope will come across to maybe more awareness about what's going on.
Yeah. With that said, though, just to play devil's advocate on this, why is it so bad if their intentions were just to help us? If this was just to help society at large, and what we've seen here with the norm pressures, that it's for the greater good, why is it so bad then?
Yeah, I think that's the noble lie argument, isn't it? These are noble lies. And it's probably worth just in answering that, just to say that I've gone through, I think, at least 3 phases of trying to explain what's actually happening. In the early stages, I was attributing it to panic and incompetence. I'm not a conspiracy theorist. I never have been. I've never been on a march prior to 2020. I'm quite a naive guy. Get the head down, work hard, broadly believe what the government's telling me by and large. But then that became inadequate explanation. Then so it moved into like opportunistic agendas, jumping on this, and then I don't think that's adequate anymore. I do very much believe that this was kind of virtually planned, actually, like a globe, or at least they plan to exploit the next pandemic. And I think there's enough evidence, accumulated evidence now, about some pretty egregious globalist actors that are kind of pushing this to the detriment of the vast majority of us and to the betterment of a few kind of elites. Which if somebody said that to me in 2020, I'd have probably called them a conspiracy theorist. So I appreciate that might sound extreme, but the more I've studied, the more I look into this, Sonny, the more kind of I think it's been exploited at the very least in a big way. Some of these guys were having desktop exercises mimicking what they would do in these kind of circumstances.
Event 201 was specifically a coronavirus pandemic, and then you had, I want to say, maybe 3 months afterwards, a monkeypox outbreak tabletop exercise as well, which we're now sitting in the middle of, if you ask Tedros from the WHO.
Yes,
So I wholeheartedly see where you're coming from with that.
But back to your original question about the noble lie, I know that would fall down when you actually look at things like the restrictions, which for the most part, pretty much almost totally, have been non-evidenced, contentious. They've kind of trampled all over our basic human rights. And as you know, the pandemic management plan that was carefully put together prior to 2020 was just completely ripped up and thrown out the window. So, they've jumped in with these kind of contentious restrictions that, by and large, no real evidence for them. Benefits, a lot of evidence now that they do a lot of harm, and trampling over basic rights along the way. And I just think if you're going to do something like that, you've got to be to mandate things and to use some kind of fear and coercion. For that to be justified, you've got to be pretty confident that what you're doing is going to be hugely beneficial to our society.
Yeah, it's funny you mentioned that our previous pandemic plans were thrown out the window, because it seems like as soon as China started doing their lockdowns, that was the thing that was adopted across the globe. Essentially, the WHO decided, hey, this is a decent response, guys. We should follow this. And all of a sudden, every other country fell like dominoes in the sense of bringing in these hard lockdowns. You can't leave your house. In Ireland, you were 5K from your house, and that was it. In Australia, you weren't allowed out unless it was for set things. You were arrested and thrown into quarantine camps if you dared to break the rules or what have you. And yeah, I could go on the different places that an approach that flew in the face of all other pandemic planning was just adopted like nothing was going on, like there was no issue there. And then we get into these elements of coercion that you mentioned just there, where you're a psychologist, Biderman's chart of coercion, the thing that they used in Vietnam to break down prisoners of war, essentially using isolation, monopolization of perception, humiliation, exhaustion, threats, occasional indulgences, and demonstrating this level of omnipotence that the government has. And every single one of those things we can pin to a part of the approach that the government took to just break us down and ensure that the majority of the population followed the rules, from the hard zealots that were all for everything that came their way. Your Keir Starmers that said Boris Johnson failed because he didn't lock us down hard enough. That is outlandish as that sounds today. But you have people like that. Then you had the people that were totally against it. And then you had those people in the middle that just kind of went with the flow as the stream goes in the middle of that. And it's no wonder that they did. And these moderates, these just the good people, if we call them that, is reminiscent of what happened in the 1930s as things started to go downhill.
Yes, quite. And some of the terms used to justify this onslaught on citizens also echoes the 1930s, doesn't it? The greater good phrase you use, that chilling phrase, really. This is for the greater good. Another one that really kind of pushes my buttons is that this is the socially responsible thing to do.
Horrid.
I really, these kind of phrases should trigger us, I think. And I think you're right, Sonny, as well. There was this group in the middle who, understandably, to a large extent, I think, just didn't want the hassle. It's only a mask. It's only for 3 weeks.
Just to flatten the curve.
It's only a one-way system around the supermarket. It's only not visiting, grandma for a week or two. I kind of understand why, because it can feel a pretty lonely place. I'm sure you can testify, being this minority voice out there and not following the crowd. Again, normative pressure nudge, which is what they've exploited. So I can understand why people kind of have gone along with it to some extent. But I don't want to sound too doom and gloom, because I think people are waking up a lot more now. I think more and more people are kind of putting their head above the parapet. Over the last few weeks, I've heard a number of people in my day-to-day life who were pretty much very pro-narrative, pro-dominant narrative through 2020 and early 2021. And they've been saying to me things like, I'm not going to wear a mask again. If they try and lock us down again, I'm not doing it. I'm going to continue to see my parents. Really kind of,
standing up a little bit and saying enough's enough.
Well, I think it is crumbling a little bit, but never quick enough. That's the problem, of course. And
but I think, especially coming on to the next one, is that Susan Mitchie, who was one of the members of SAGE, working on the behavioural insights there that the government was utilising, is now in charge of something similar within the WHO. And we know that the WHO have just recently also declared monkeypox and other international pandemics. So as much as it feels like people are waking up to what was happening around them. There's also this element of that chart of coercion isn't going anywhere, and it's as powerful as it is because it works, despite the fact that people have known about it for X amount of decades. It's not something you can easily protect yourself from.
Mm.
These nudges that are there for a reason, and they work for a reason. So what can we do if we are waking up to it? How can we avoid making the same mistakes and falling into the same pitfalls?
Mm. Yeah, it's a central question, isn't it? I think just on the WHO, though, I think they are kind of quickly losing credibility.
Yeah.
I think, and the reaction to the monkeypox, being kind of, as a pandemic of concern or whatever the phrase is these days. I've seen a lot of people react kind of with laughter to that, which they wouldn't have done back in 2020. So I think the way I see it, Sonny, is I think because some of the dominant narrative is crumbling, particularly around the vaccines. I think that's the key one. I think the vaccine efficacy and has been kind of overstated, and the potential harms have been understated, to say the least. And I think more people are becoming aware of that now, even though they're desperately trying for that kind of information not to get shared.
Yeah.
And I think what's happening, just to go back to my kind of globalist pushing a lot of this stuff, is that they may be being forced to go a little bit too quickly than they would otherwise have wanted to. I think that might be to our advantage, because I think sometimes they can look quite ridiculous because they're trying to
speed things up, playing their cards too quickly. Yeah,
that's my hope. Anyway, as far as how can we kind of protect ourselves from nudging and from manipulation, probably three main ways, really. I think one is to try and distance ourselves from the sources of the psychological manipulation. So here, of course, I'm talking about just get off mainstream media, try and do read stuff rather than watch videos, kind of thing. Read books, blah blah. Do a bit of mindfulness training maybe at times. Go up in the hills in nature if you could. There and spend some time away from it all. I just think simple things like that help. Just give you a bit of distance, because remember, nudges work because human beings spend 99% of the time on automatic pilot. The fast brains in control, so they're not really thinking about what they're doing or
how they're doing it,
why they're doing it, the reasons for it. They're on autopilot, and that's what these things exploit. Whereas if you get back in nature, do a bit of mindfulness, disconnect from some of these main sources of propaganda, is a key one. The second of the three ways of protecting ourselves is to try and develop an alternative narrative, which does involve perhaps reading things that a lot of people don't read, and not just being dependent upon the public health bodies and the dominant narrative, skip out a warped view of what's going on. So try and read a few of read the Great Barrington Declaration, read some heart stuff, just read more widely, and then reflect on what you're reading. But the third one, and I think this is really the key one in a way, albeit the toughest, is we need to stop behaving in keeping with these ridiculous and harmful kind of recommendations. I might get a lot of vitriol targeted in my direction from various sources for that, but I would continue to wear masks. We're perpetuating fear. We're perpetuating nudges. If we continue to follow a lot of these rules, should they come back, which they're likely to, I think, in the autumn and winter time, it's only keeping 6 feet apart, not elbow bumping rather than handshake.
Yeah.
Nonsense. No, that's really is unhelpful. And because again, if we keep behaving like everything is not going to be normal again, then it won't ever be normal again. Shake hands, hug, let's have fun, interact, drop the mask. Unless you're obviously rampantly symptomatic, of course, like we used to. If I had flu, I wouldn't go to go and see the old mother.
Yeah.
We use common sense, but all this kind of distancing and quarantining the healthy and all this nonsense, just got to stop.
Well, funnily enough, that's what our good friend Susan Mitchie wanted. She's quoted as saying she wanted all the restrictions to be kept for life, from social distancing, masks, and all the rest of it. It's again so easy to fall into that trap and that way of thinking and that way of being as well. And this idea of going back to normal, well, there's this idea of a new normal that was touted throughout the pandemic and throughout the government response of, we're going to the new normal, yada, yada. And that was from April of 2020. So we're not even that far into what's happening here. And yet they're already saying, we're not going back to how things were. Again, that sort of feeds into your idea of maybe there was a bit more planning behind this, of a grander scheme of things. And when you say that, then you've mentioned the globalists, or this idea of globalist entities who were working for each other or themselves. Who is it that we're referring to here? Who is this they?
Yes, another good question. I think it's a range of people, isn't it? I think we're talking some combination of your tech industry owners, your billionaire tech owners, your big pharma companies, your various World Economic Forum people, your Vanguard and
Blackrock.
People. This group of extremely elite, very, very rich people who kind of got this vision, as they would call it, for this technocratic, inhuman sort of world where we're kind of constantly under surveillance, constantly controlled, digitalized systems, where they can kind of control, in their view, sort of the green agenda, for example. I can picture a time, if we carry on down this route, Sonny, that we'll reach a point where we don't have cash anymore, and my kind of debit card, I'll be in the shop one day and I'll kind of try and buy some bacon or something, sausages, and he'll go, oh, can't do that, you've exceeded your monthly limit for meat this year, or
this month, or you said something online that we don't like. So
exactly, and again, I would have thought that's pretty conspiratorial going back a couple of years, but the more I delve into this now, I realise how naive I've been, and these things are real, undoubtedly, and I think we do need to resist them.
See, I'm with you. In that I also see this bigger picture. There's an episode I recorded with a chap named Arno Wellens. He's a financial journalist, used to work in the financial industry. And he looks through all the white papers, looking at these ideas and these things, how they've come across, and how the EU are signing everyone up to have a citizen number by this summer, and how this idea of a central bank digital currency, although it's now coming in, it's actually something that they've been planning for quite some time. And the idea of a central bank digital currency of no more cash, like you said, helps to get rid of this mass inflation and gets money to just be ones and zeros on the computer, so it can be manipulated very easy. And it's also something that is very quickly equatable to the Chinese social credit system, which, again, like you say, it sounds quite conspiratorial, but if you look at China, and see what they're doing. There are people there that can't buy bus tickets, and it's very easy to say, oh yeah, but that's China, and he crossed the road wrong, and that's their rules there, so that's what they do. Okay, that's fine, you can say that. But then in Canada, we had people who were just donating to a protest have their bank accounts frozen. They didn't even have to turn up. This is Western civilization, if we want to call it that, and say that they said, no, your bank accounts are done. You don't have access to your money anymore. So the idea that once money goes completely digital, which for all intents and purposes looks like it is going to, unfortunately, then you do lose power. You lose power in buying, and then you're potentially going to be told where you can buy and where you can sell as well. You know, this is something Rishi Sunak was talking about not too long ago in Parliament, about introducing the central bank digital currency in the UK.
And these cards, credit cards, I believe a couple of them have already been piloted in the UK,
yep.
albeit on a voluntary basis for the time being, where you can actually get this card, and it would limit the amount you spend each month on a variety of things.
They've got carbon credit cards as well, whereby if you're even if you've got $1,000 in your bank account still, if you've gone over your carbon tax limit, then you can't buy anything else. You're screwed for the rest of the month. Good luck getting some meal on somebody else's meal ticket.
Yes, I really am concerned about our direction of travel. Not so much from myself now, because I'm 63, nearly 64, but like my kids and the grandchildren, I do worry about the sort of lifestyle that they're gonna have.
Yeah.
And the one we've taken for granted, I don't know that I've taken for granted throughout my life, throughout my 63 years on the planet, of having some, basic freedoms to see, by and large, who you want to see and move around the planet, pretty freely, by and large, all those kind of things we all took for granted. I think
it's I don't know if you're familiar with the book In Order to Live by Yeonmi Park.
I'm not. No, I'm reading the Naomi Wolf one at the moment.
Nice.
The Edward Kennedy one as well, on the Pouchy, which was an eye-opener.
Oh, that's a brilliant book. Yeah.
I haven't this one, sorry.
So Yeonmi Park is a dissident essentially from North Korea. She escaped, and she basically gives you a play-by-play of her life growing up in North Korea and up to her time of escaping North Korea, her journey out to South Korea, through China, and then over to the US. And one of the things that she talks about briefly in the book is that there was a generation who would be old enough to remember life pre the Kims, but no one of her generation will know anything about it, and her parents won't speak about it. And it's one of those unwritten things that just goes unsaid, and it's a bit of, I suppose, norm nudging, in that you don't speak about these things, and anyone who doesn't follow the dictatorial way of being there and wearing the right clothes under the dictatorship or what have you is then grassed up, and their life is then ended. But it's funny to see how you potentially, maybe in a different way, we're slowly walking down that pathway of, I've now got a 7-month-old and his life is going to be completely different. I don't know if he will have the opportunity to go fly into the States, if dad can get him out to see his cousin, or of him going and traveling in Asia, or going to see South America. These kinds of things that you and I are privileged to be able to say that it's an opportunity that we could or couldn't do, whether or not we wanted to do it. Whether or not they will have that opportunity is a whole different story, which is kind of crazy to think. I'm quite privileged.
I think we were talking earlier about I've just been to Croatia on holiday, and I don't think it's any coincidence that these European people, with exceptions, but by and large, have been somewhat less compliant with a lot of these restrictions, and quick with them as well. And I'm sure at least a key part of that is around having some kind of memory, of totalitarian, tyrannical regimes. Whereas a lot of us in the West don't really have that. We're naive.
We've lived too privileged.
Exactly. Yeah.
It's that saying that's going around of hard times create hard men create soft times create soft men, and that's kind of what's happened in the West in relation to those people who have lived under totalitarian rules, and it's scary to see. And the reason that I went up to that globalist level was to ask you, actually, okay, it's all well and good saying that there are these guys at the top that are pulling the strings like puppeteers, but how does that come down to your level and my level here at that ground level, at grassroots? Because how is it that Blackrock and the tech companies have so much control over us, the general population, if they make up such a small minority, and they have to then control all these companies with hundreds of thousands of employees going across all these different sectors? How has it been so easy then? How can you?
I just think they are so awesomely powerful. I know one of the more sobering things I did for 18 months ago was just looked at who owned what companies, and like to take the Coca-Cola and Pepsi-Cola, which I thought was like typical capitalist competitive.
Not at all, yeah.
How naive I was, and perhaps still am to some extent. I thought, wow, they're owned by the same people. Wow, real eye opener for me. That. And I think if you just when you start to research and dig about these things, they are awesomely powerful, and they, with their money and influence, they do put a lot of key players in this further down in quite conflicted positions. If you look at our regulatory bodies for the drug, for vaccine regulatory bodies and so on across the world, if you actually look at the membership of that and actually look at the funding and the people that are involved in that, it's really difficult to find
clean places,
non-conflicted individuals, really. I got kicked off Twitter for a few weeks, last year, because I posed the question about, can somebody, and it was a genuine question, I was genuinely interested, can someone kind of point out an academic institution that's involved in vaccine production that's not at least partly funded by either the Gates Foundation or its various spin-offs, drug company money, or the Chinese Communist Party? It's probably the last bit that got me thrown off, I think.
Definitely the last bit.
It was a genuine question, because a lot of our institutions, we look at some of the key players in the UK around vaccines, and some of the modelling, let's say, actually look at where funding for those departments come to. They would not
ridiculous.
Would not function without this money. So I think there's lots of people. They're not all, the majority of people aren't bad. They're not all kind of bad actors. I think there's some really egregious people at the top, but I think in the middle areas and that, I think a lot of people are conflicted. I think they're either groupthink or kind of cut off from reality, or more commonly, I think, conflicted by their by money. If I have to think myself, if I was still in the system, if I was a working scientist in the system, I had a mortgage to pay, kids to feed, and I knew that 90% of my department's funding came from these sources, and that they had the power to stop that at a stroke. Really, you could stop that tomorrow if they chose to, and I'd be kind of vilified, maybe lose my job, certainly not get any more grant money, any research money. How would I behave? And it's a really key question to reflect on, I think. So I think a lot of people are in that position, and they might rationalise that they agree with the main narrative, but I'm sure there's a lot in there that realise this isn't right. But are they prepared to kind of sacrifice?
Well, this was the thing, right? What you're saying about the grant money as well. obviously, you know about the Voldemort of drugs, ivermectin. Tess Lawrie was the second author on either a meta-analysis or systematic review, and the main author had come out and said, "Oh, due to a mistake, actually, the results show ivermectin isn't actually useful." To which Tess had a conversation with the fella in private.
So curling, wasn't it, the video to watch that?
Oh my gosh, where he openly admits to the fact that they were going to withdraw his funding. So he said what he had to say to ensure that the funding went forward. I think it was 40 million or something like that of funding for, I think it was Liverpool or Leeds University. I can double Liverpool. Yeah. And she said, yeah, but what about the actual results? What about what's happening here? And his response was, I figured somebody else would continue doing work and research into it, so it would come out at a later stage. I'm obviously paraphrasing here, but my gosh.
Yeah. Well, it is really truly scandalous, the level of censorship across not just the media, but the scientific community as well. Again, it's something that I would never have thought would ever happen in a so-called Western democracy. You know, you just cannot believe really anything in a scientific journal at the moment. It's a strange place to be.
I don't even believe we live in a true spirit of democracy now anymore either, if I'm deadly honest with you, looking at how so I live in Amsterdam in the Netherlands, and looking at how things went here and looking at how things went in the UK and the US and Canada and Australia and New Zealand, it's hard to think these democratic countries who are meant to stand up for people's human rights and freedoms are what they say they are. Had it not been for people like yourselves with the Heart Group standing up and saying something, and people like your Pierre Corys and your Robert Malones who said something to poke enough people into saying maybe we shouldn't do this, I think we'd probably be sitting in perpetual lockdowns had it not been for people standing up.
You may be right, and it comes down to making our dissent visible, I think. Julius Seychelles is a Canadian journalist. I don't know if you've read any of his stuff.
So no, really, not familiar.
Yeah, really worthwhile reading. You know, he talks about we've got to challenge, what's he call it? This illusion of consensus. This idea that the large majority of people are on board with this, because I don't think that's the case. It's that silent middle again with lots of, and we can do that. You know, we don't have to be a kind of hero to do that. I don't think. You know, I acknowledge it's easier for retirees like me than people who are on the front line. But we all can do that. You know, a conversation with the hairdresser or with a shop assistant or the barman, just making dissent visible.
Yeah.
You know, in as many kind of places as we possibly can. Your farmers over there in the Netherlands.
They're doing a good job. They're doing a good job.
You know, that's the kind of thing you need, visible dissent. You know, like the Canadian truckers was the same, wasn't it? This is what we do, and we all can do our own little bit. Like I say, we don't have to get a big platform. I just think with relatives and friends, you know, I could give you one example recently. You know, lots of my friendships have kind of changed over the last 2 years, which is quite sad in one respect, you know, but it's also got new friends, which is good as well. And we've always had an annual outing to Germany. We called it the lads and dads.
Oh, nice.
I mean, once a year. And they asked me if I was going this next year, and I said, well, I can't. You know, I said, well, what's that? I said, well, I'm not vaccinated.
Yeah.
All that nonsense will be over by next year, won't it? Well, I don't know. It might be, but at the moment it isn't. You know, and it was just an opportunity, really, to kind of share with people who I like, you know, who I respect and in some cases love, you know, greatly, and who I like to think respect me, and I've done for a long time. Just to kind of just share this is the reality of the world we're living in at the moment. You know, and I just think more and more people have really got to feel able to do that, and I think are doing that. To be honest, I think they are. You know, more people are
knocking on it. Yeah,
and it's never quick enough, is it? You always want it to go quicker, but I just think we've just got to keep supporting and encouraging people to do that. Finding areas of commonality. There's usually always something we can agree on, isn't there? You know, I think like with people around child, like I'm been adamantly against childhood vaccination for COVID. I can't see any basis for it whatsoever.
No.
And you know, you get called anti-vaxxer and conspiracy theories and all the other rude names. But you know, having a discussion with people like that, I say, well, hold on a minute. Now, I think we do share the same broad aim here, don't we? Don't we all want what's best for our children?
Yeah.
Is that right? You know, and always like connect a certain with a certain kind of area that you can agree on first.
Yeah, absolutely.
And then if you can picture a dissent that's not too far away from where they're at the moment, I think that can be really helpful. You know, I think they can assimilate some of that info, and you can have keep out of the conspiracy theory idiot boxes. Start
soft, start easy.
Oh yeah, you'll find commonality, find some area that you agree with. Point out, like I have done around the vaccines, I've always had vaccinations. You know, the kids did as well, by and large. You know, I've just chosen not to have this one. You know, so I'm an anti-vaxxer because of that. You know, so you can kind of get in there and try and keep out of those kind of you know, flat earther boxes, kind of. And then you can potentially have a meaningful, you know,
conversation. Yeah,
of ideas. Yeah, and that's happened more and more recently as well, which is good. And so I'm encouraged. You know, I do have some optimism that we can kind of.
I think
this.
That's a nice way to wrap things up as well, on a bit of a positive note on how you can broach this conversation with people as well. It's not solely on vaccine or mask or what have you, but it's also how you can broach the conversation for people to not be coerced into doing something that ultimately isn't good for their health, isn't good for their mental health, which something unfortunately we didn't get time to touch on to. But I do think that these are all important topics. And I know there's also an element of corona fatigue for some people, where they're fed up of hearing about it and fed up of talking about it. But at the end of the day, if we don't address it, we're likely to commit the same mistakes.
We can't let them get away with moving on quickly.
No.
Powers that be want to do that.
So quick. Like corona, focus on Ukraine. How can people then find you? And maybe you can tell them a little bit about Corona Babble as well, as I didn't mention that in the intro, actually.
Yeah. My blog is coronababble.com, which has got a range of articles on there around COVID, lockdowns, restrictions, nudging.
Deprogramming yourself as well.
Yes, and some, you know, my efforts and others' efforts to date to try and get the powers that be to have a discussion about the ethics of nudging. You know, the British Psychological Society and other government committees. You know, I've kind of detailed some of the efforts that we've made over the last 2 years to try and get to open that debate up. Smilefree.org is a wonderful little organisation of people who are passionate about how unhelpful masking healthy people, and, you know, dehumanising it is. We need to keep people's faces on show. You know, smilefree.org, you can find that and come and join us. It's still very active, fighting the mass in healthcare issue at the moment with
massive
the chief executives of NHS England, NHS Scotland and Wales and Northern Ireland. So we're engaged in a debate with those at the moment. Read stuff on the HEART website, Health Advisory and Recovery Team. That's heartgroup.org, heartgroup.org. Lots of good stuff on there. So those are the three main areas, really. But if I have to give one final kind of suggestion to people to think about is, you know, if you do have ambivalence and some kind of concern about this, do try and make it visible, your dissent visible to somebody. It's no good just, you know, keeping it to yourself, really. And although I do recognise, as I said, it's easier for retirees like me than people on the front line. So they're the brave ones, and I've got huge admiration for them who put their head above the parapet. But you don't have to do that. I just think it's sometimes just having conversation with a colleague or a family member or a friend as the opportunity arises. And if we can, more and more of us can do that, I do think we're at a tipping point. It doesn't have to be a majority. That I think there's some evidence about 20%, 15-20% of visible dissent will do it.
Yeah,
So
that does the trick. Yeah.
that does the trick. Yeah. So,
Or just very obvious dissent on the side of the A10 motorway in the Netherlands with a bunch of hay bales on fire as it goes.
yeah, I'm behind the car, doing a sterling job. I just wish they were getting more coverage.
Oh yeah,
media, of course, which apart from GB News over here, they're getting much at all.
no one else will do it. No, you're right. But Gary, thank you so much for your time. I really appreciate it. Enjoy the rest of your day.
It's been a real enjoyment, Sonny. Thank you for having me on.